Okay, welcome everyone. Thank you for joining this session. My name is Renee Konidis and I will be your speaker for today's topic. I am a clinical coordinator and registered kinesiologist at the cardiac rehab program at Toronto Rehab. A couple of ground rules for our session today. So just a reminder that these sessions are for education only, and we encourage you to ask your health provider for any specific advice about your own situation. And if you have any questions during this session, you may use the Q&A box, which you'll find on the Zoom toolbar. And so you can type your questions in there, and then I'll be able to get to them at the end. So today's topic is all about health behaviors to help prevent complications from diabetes. And I also want to thank my colleague, Nicole Sandison, for putting these slides together for me. So this was a true team effort. By the end of this session, you will be able to identify some of the complications that can occur with diabetes over the long term. I'll talk about targets for A1C, blood pressure, and cholesterol. And then I'll cover the health behaviors that you can do to help manage diabetes. And something that we'd like you to think about after this session moving forward is to remember to have a conversation with your own doctor about your specific targets for A1C, blood pressure, and cholesterol, because everyone is a little bit different. So this is a reminder that these are the long-term health problems that can be related to diabetes. And this is from having high blood sugar, so more sugar than usual running through your bloodstreams every day, all day for many, many years. And then this is what could happen in the long term and what it could lead to. So this high sugar in your blood can affect your brain by causing a stroke. Your eyes can be affected because you have, the small blood vessels that end at your eyes. The sugar can damage the arteries there. Can affect your heart by leading to a heart attack. Your kidneys by causing your kidneys not to function properly. It can affect the nerves throughout your body, so leading to sensation and tingling. It can affect your reproductive organs, affecting your legs and feet by affecting the blood flow that goes to your legs and feet. And then the nerve damage as well can happen in your feet, just as it can in your hands. So if you looking at this picture, it's really all of the end points. If you think, as the blood is flowing and running through your body, as it gets to the end point and then circles back to come back to the heart and lungs to pick up more oxygen to circulate around your body. It's those end points where the arteries become smaller that really can be affected by diabetes. So there are a few things that you can do that you have control over to help manage all of this. So there are a couple of targets that are good to keep in mind when you think about your blood that is measured with your doctor or your blood pressure. So I'll talk about A1C first, and we like to call this the ABCs of diabetes. So A1C, blood pressure, cholesterol. A1C refers to a measurement that is done in the lab when you take blood, when they take blood from you at the lab and then it's measured. And the A1C measurement, it's an easy way to describe this is almost like a 3-month picture. So looking at the previous 3 months of how well your blood sugar was managed over that time. And it's specifically measuring the glucose molecules that are stuck to your red blood cells. And so the target, the unit of measurement is a percentage. And the target is to have this number less than 7% whenever this is measured. And less than 7% means that you have a fairly good management of your blood sugar. And the ups and downs of the blood sugar are staying within a good range. If your A1C is measured and it's over 7%, that lets you and your doctor know to look into other ways that you can help manage blood sugar. So you might need a change in your medicine. It could mean looking into your other behaviors, so your sleep, your activity levels. All of these things can affect blood sugar. So checking all of those areas is a good way for you and your doctor to start to help get your A1C less than 7%. Blood pressure targets. So the targets for blood pressure, if you are living with diabetes, are a little bit more strict than the general population. And that's because diabetes in itself is a risk factor for heart disease. And so blood pressure is as well. So the targets get a little bit more strict. And the guideline is to have blood pressure less than 130/80. Cholesterol levels. So cholesterol can be broken down into different components. And the numbers are there. So the LDL, that's the cholesterol that you want less of. Ideally, that the target for that number is less than or equal to 2. Your HDL, which is your good cholesterol, so you want that to be a little bit higher. That number can be more than 1. And then you have a cholesterol ratio that's looked at, which is ideally less than 4. And then triglycerides, so a separate measurement. That number, the guideline is to have that less than 1.7. So these are numbers that you can review with your own doctor. So healthy habits can help these ABCs of diabetes, the A1C, blood pressure, and cholesterol. So I'll run through those different behaviors now. So the first health behavior is exercise. So the exercise is important because it improves your body's response to insulin and it lowers the blood sugar, so the sugar that's running through your blood. Exercise can also help blood pressure. So it's doing 2 things at once there, or really multiple things at once are happening when your body is exercising. There's lots of benefit. And the target for this health behavior is to exercise for 30 minutes most days of the week. And this can include aerobic type exercise, so walking or cycling, as well as resistance training to help strengthen your muscles. The next behavior is to manage stress and sleep, making sure that you have good quality sleep. Both of these things can affect your blood sugar. So this is important. As I said, if you're in chronic stress or you're not sleeping well, which is another type of stress for your body, then that can raise your blood sugar. And so the target for this is to find ways to cope well with any stress in your life. We don't expect you to completely eliminate stress because that isn't realistic. Everyone will always have some stress in their life, but it's about how you respond to that stress and finding healthy ways to manage and cope with that. And then also making sure that you have restful sleep. And so that might mean getting to sleep close to the same time of day each night so that you have a good routine for your body, getting enough hours of sleep, and having good quality sleep. So a common condition that can also happen if you're living with heart disease or diabetes is to have sleep apnea. And that's where your body stops breathing throughout the night. Not enough to make it dangerous, but enough that it wakes you up and stirs you in your sleep so that you don't get quality sleep throughout the night. And then that is a big stress on your body if that's happening night after night after night. So that's something you can talk to your doctor about if you feel that you're not having good quality sleep. Another health behavior to help manage your blood sugar is to eat healthy. And so this is a very vague term, but I'll go through the targets here. So eating healthy can help to improve your blood sugar, your blood pressure, and your cholesterol. So you're getting all of those, the ABCs there. And so what that means, eat healthy in general, trying to lower the amount of sodium in your diet, eating more foods that are higher in fiber, lots of color with fruits and vegetables, less saturated fats, and a wide variety of foods so that you're getting lots of vitamins and minerals in your diet. And you can meet with a dietitian who can help you really fine tune what that would look like. And there's also resources on the screen here, which I'll point out at the end as well. Some information on how to choose healthy foods. So this target is to lower the amount of foods that you eat that contain sodium, saturated fats, and foods that are high on the glycemic index. And glycemic index is just a rating of different foods and how fast your body would digest these foods and break them down. And so something that is low on the glycemic index would get broken down, digested really fast, and then your blood sugar would spike more quickly. Something that is higher on the glycemic index takes a little slower, more time to digest and break down, so therefore your blood sugar has a more gradual rise after eating. And then as well, so looking to eat more whole foods with unsaturated fats. So if you're able to prepare more food from home, that can make a big difference as opposed to eating frozen prepared meals. And foods that are rich in omega-3s, fiber, vitamins, minerals, and that are more low, medium on the glycemic index. So partner with your doctor in care. This is really important. So having a good relationship with your family doctor, your primary health practitioner. This is important because learning the skills of self-management can help get you the care and support that you need. And because you are living with diabetes for your whole life, this is a lifelong condition. So it's really important to have those skills set up where you are able to be aware of what it is that your body needs, or when you have questions for anything about your condition, that you have that partnership with your doctor. And so your doctor will go over these particular targets as we're talking about for the A1C, the blood pressure, the cholesterol. And it's good to have knowledge and know what these targets are so that you can have these conversations with your doctor. It's important to know all about your diabetes medicine, so what they are, how they work, how they affect you, and talk to your doctor if you notice any side effects that are affecting your quality of life, and you can have discussions around that. You might need to track your blood sugar, your blood pressure, and your cholesterol over time, and that just helps you learn your own body's pattern. It lets you know how your body is responding to different situations, and you get to see how your blood sugar and blood pressure change with different situations. Cholesterol measurements, which is more something that's done in a lab, so that would be a longer term number that you could also track over time. And then make sure to follow your regular appointments and checkups for your eyes, your feet, your heart, your brain, your kidneys, all of those endpoints that I mentioned. Over the years, it's important to make sure that all of those systems in your body are functioning well as you're living with diabetes. So a couple of other important tests that your doctor will most likely do over the years. So there's a screening test that tests for neuropathy. So this is relating to nerve damage. So if you're having any sensation problems or tingling in your hands and feet, your doctor will use sort of it's called a monofilament. It's a little instrument, and it has a very little small fiber, and they would use that to touch certain points on your feet to check if you can feel those different sensations in different spots on your feet. And that's how they can check for any numbness. They want to know if your feet can sense the vibration, light touch, or your reflexes. And this test, this would be good to have this test done at the time of your diagnosis. So it's always good to have baseline numbers with any testing. It's most likely to be repeated every year to check for any nerve damage. Also, if you have any changes in your skin, if your skin starts to look any different, if your skin becomes more dry than usual, if you have any cracks in your feet, like cracks in the skin around your heel, those sorts of changes you want to make sure that you review with your family doctor as well. Another test looking at your kidneys is checking for nephropathy, so anything that's affecting your kidney function. So this is a blood test. It's called the albumin creatinine ratio. Most likely your doctor will have this checked when you are having your blood checked, or when you do a urine test. They can look at all of these numbers. And again, this will be done probably when you're first diagnosed and then repeated every year after that. So watching those numbers to see if there's any change over time. And then another important test for your eyes. So looking for retinopathy. Retinopathy is when the small blood vessels on your eyes can become damaged. This is important to make sure that you are seeing an eye doctor if you are living with diabetes. And your eye doctor will check your eyes for any signs of eye damage, and they can monitor that over the years as well. So important when you're first diagnosed to have a check with your eye doctor. And again, repeating every year to monitor if there's any changes. And then if you notice any changes in your vision, in terms of, reading, or if you're having, spots in your vision, anything like that, then make sure to go and see your eye doctor to have an extra check. Okay, oops. So the resources that we have that are all available to you, you can go to Diabetes College to learn more, and that's our patient education website. That's www.diabetescollege.ca. And you'll find lots of information there. There is our printed guide that you can download right from the website if that interests you. And then the Thrive program consists of the 12 different modules on these different topics that are related to health behaviors for diabetes. And so each module contains a short YouTube video, about 5 minutes, explaining the topic, and then it can walk you through setting up some action plans if you'd like to focus on any of these new behaviors and start to make a new routine for yourself. So to review what we talked about today, so I talked about some of the long-term complications that can happen with diabetes over time. So important to be mindful of those and watch for those and track that with your doctor. I gave you the targets for A1C, blood pressure, and cholesterol. So you can talk about those specific ones with your doctor. And some of the health behaviors, so different ways that you have control that you can help to manage your blood sugar over time. And don't forget to review all of this with your own doctor, since these are guidelines and targets for most people, but everyone's a little bit different, and you might want to have a specific conversation with your own family doctor. As well, we have on diabetescollege.ca, if you click on My DP, which stands for My Diabetes Program, this is now live part of the website where you can have a look at the program manuals that are used when you're enrolled in the diabetes program at Toronto Rehab. As well, you can click on the live education sessions, and that will bring up the calendar to let you know of any future sessions that are happening, and you can register for those. And if you are on Twitter, please follow us on Twitter. So Health eUniversity, this is the one-stop shop for all of our patient education material, so both cardiac and diabetes. And you can follow along on Twitter and get all of the latest updates with new information and new education resources. Thank you for joining us today. Next session will be titled, What is a Heart Attack? And that's presented by Dr. O, and he will be explaining all those details, and that's happening on Tuesday, April 6th at noon at 12 p.m. All right, I don't see any questions in the question box. So again, thank you for joining, and hope you can catch the next session. Have a good afternoon.